talk to you about patient privacy, which is a topic that we've alluded to and had conversations about for this whole conference. And in fact, it governs so much of what we're doing with respect to data and sharing data and research and e-patients and their experiences. And I wanted to start with Farrah Fawcett, which is sort of a interesting way to start a conversation about medical privacy, and yet entirely relevant as well. You see, it was 8 years ago when I was in Farrah Fawcett's living room in Los Angeles. And I know some of you are probably thinking, what is health reporter Charles Ornstein doing in Farrah Fawcett's living room? Which is a totally appropriate question, right? But here's the deal. Farrah Fawcett, there had been a rash of celebrities' medical records which had been breached in Los Angeles. And Farrah Fawcett thought that somebody had breached her medical records and in fact leaked the information to the National Enquirer. So in 2007, she set up a sting. She decided, when she found out that her cancer had returned, that she was not going to tell anybody except her father. And she kept this a secret. And sure enough, within days, the news was in the National Enquirer. So she knew it had come from UCLA. And she told her doctor this. And in fact, it had turned out that an employee at UCLA had gone through her records and had sold the information to the National Enquirer. And that employee was later indicted. But Farrah Fawcett's story was important because it showed that you can be a regular patient or you can be a celebrity patient, but your concern for privacy, your concern for your own medical records is incredibly important. And it doesn't matter who you are, that breaches of patient privacy are things that are super important and can affect you. Last year, I spent the year reporting on patient privacy and reporting on it in a far more depth than I had with the Los Angeles Times. And it was driven in large part because of one story and one man that got me interested in the topic. This is Anitachenko. Anitachenko, her husband Mark, was crossing the street in 2011 in New York, and he was hit by a garbage truck, and he was taken to a hospital in New York, and he died. And a year later, Anita was watching TV, a TV show called New York Med, and on TV, she recognized a guy who's brought on screen who had just been hit, and they show him as doctors are trying to save him. He says, does my wife know I'm here? You hear him moaning, you hear him groaning, you hear him die on TV, and you see a doctor go into a room, and you see him enter the room, and then you see sort of a wall that's frosted over or a glass door, and say, I'm sorry, we did everything we could to save your husband, but we were not successful. The family did not give their consent, and neither did Marchenko to be included in this series. In fact, the filming took place without anybody's knowledge or consent. They didn't tell her her husband was going to be on TV. Her first knowledge was sitting in the middle of the night watching this on TV. And there was no apology really forthcoming as well. Now, New York Presbyterian Hospital recently settled with the US government, the Office for Civil Rights, for $2.2 million. But they don't believe that they did anything wrong. So that, to me, brought up this major topic in my mind, which is, who is protecting our privacy? Who is looking out for us? It's our right to share our information with people we want, but what about when we don't want to share that information? So last year, I had the opportunity to meet people all across the country who've had their information breached in ways that they did not want. I met folks like Andrea here. Andrea was a senior at Yale University, about to graduate, when her world started getting smaller. She was depressed, and she started drinking and feeling suicidal, and she was hospitalized against her will for a week. Part of the reason she was depressed was that she had a broken relationship with her parents, and the school decided to call her parents and tell her she was in the hospital and suicidal, and her parents, against her will really, took her out of school and forced her to come home with them, where she said sort of the verbal abuse from her parents continued. This was not a case in which the law that we all know as HIPAA was in place. In fact, there's different laws that affect college students, but Andrea nonetheless felt that her medical privacy had been breached without her permission. I met folks like Alicia, whose face you don't see here, but Alicia had an abortion in Nebraska. And during her abortion, there was a tear in her uterus, and she started bleeding and was taken to the hospital. Somebody from an anti-abortion group took photos of the ambulance leaving the abortion clinic, and they filed a complaint with the state, which then sent a subpoena to her doctor to get all of her records, and nobody told Alicia what had happened. Nobody told her that they were accessing her records. It was only months later that she found out that she was part of this investigation into the doctor, not because of anything she did, but somebody got her involved with this against her will, and she felt incredibly violated because of this. This is Janet Hartranft. Janet was a resident of a nursing home in northern Michigan when her nursing assistant decided to take out her cell phone and take pictures of Janet on the toilet and post them on Snapchat. That nursing assistant had been warned repeatedly about using her cell phone in the nursing home and had been told not to use the cell phone. She'd been caught, in fact, taking pictures of another resident, but she was allowed to continue working. We found more than 3 dozen cases across the country where people were nursing home residents or assisted living residents were filmed in compromising positions, naked, on the toilet, being abused, being hit, being sworn at, and those pictures were being put on Facebook, Instagram, and Snapchat, and nobody was doing anything about it. We met people like Jackie Stokes. Jackie, in 2014, decided to go to her Walgreens and bought an at-home paternity test. I didn't even know it was a thing. She didn't know it was a thing either. She didn't have doubts about the paternity of her daughter, but she's like, this is cool, I want to check it out. So she checked it out, and indeed, like, her husband was the father of her daughter. Like, there's no surprise there. But what was a surprise was that when she went online to get the results from her paternity test, she's a cybersecurity consultant, so the web address looked weird to her. So she decided to take the numbers off of the web address and was then taken to a folder with the paternity test results of 6,000 other people. She filed a complaint with the Office for Civil Rights within the U.S. Department of Health and Human Services and was told this was not a violation of HIPAA, that HIPAA did not cover at-home paternity tests, and encouraged her to file a complaint with another agency. But there were no repercussions for this breach. I met this attorney here who received psychological care at a New Jersey psychological group practice, which was a very prominent group practice in New Jersey. And he did not pay his bill. He was having hard times. And so the psychology practice decided to file a lawsuit against him, and included in the legal papers, he later learned, was his diagnosis and the DSM code that referred to him. And upon further investigation, he found that they had filed suit against 3 dozen other people, including the parents of minor children who hadn't paid their bills. And they included the diagnosis information for each one of them, including the names and dates of birth of the kids and their psychiatric diagnoses. He filed a complaint with the Office for Civil Rights of the U.S. Department of Health and Human Services and was told that HIPAA did not apply to this practice because it was a cash practice. So HIPAA doesn't apply in cases where it's a cash practice, so there were no repercussions for them putting his diagnosis information in court records or those of several dozen other people. We've created a tool at ProPublica called HIPAA Helper, which enables you to look up and see for particular organizations, hospitals, health plans, pharmacies, the HIPAA violations that have been found by HHS against institutions. This is not information the government normally releases, but we received it under a FOIA request and now make it public, so anybody can look up their institution and see about violations of HIPAA there. Finally, that brings me back to Farrah Fawcett. And Farrah Fawcett said to me in the interview, she said, you know, isn't everybody entitled to privacy? Isn't everybody entitled to decide who knows their information? And she told me that the fact that this was public made it harder for her to heal. So as we have a conversation, and we're going to bring out the panelists, as we do so, it's important to remember this is all about patients. I'm not showing you slides here with statistics. I'm not showing you documents. I'm showing you people, real people, who've been affected by breaches of their privacy. And I hope we keep that in mind as we have our conversation. So let's bring out the panel.